Welcome to the Plant Trainers Podcast, where we're helping people improve their quality of life through nutrition and fitness. And now, your hosts, nutrition and wellness coaches, international speakers, Adam and Shoshana Chaim.
Hey, I'm Adam Chaim.
And I'm Shoshana Chaim, and we are
Propelled by Plants. Today we bring to you episode 263, Preventing Surgery and Accelerating Recovery with Dr. Douglas Wan.
In today's episode of the Plant Trainers Podcast, we talked to Dr. Douglas Wan about preventing surgery and accelerating the act of recovery. Dr. Wan is a fountain of information when it comes to the effects of the plant-based diet and what it has on the body and its ability to heal. He wows us with the plant-based diet and how it could prevent people from actually having surgery but recovering better. His 4 pillars that he shares goes beyond longevity or feeling great. He's really telling us how this affects our stem cells and allows us to live longer and younger. We are very excited about his anti-cancer smoothie too, so stay tuned for that. You're going to want to share this episode with everybody you love. There's some really fun ways that you can do that, like taking a selfie of listening to the podcast and then tagging us and writing one line about your biggest takeaway on Instagram, Facebook, or simply press the share button from the Plant Trainers Facebook page. And if you're going to tag us at Plant Trainers. Please share out this episode with everyone you know, as it may help someone avoid surgery, heal faster, live longer or younger. Don't forget to subscribe to the Plant Trainers Podcast. Leave us a rating and review because that helps other people find us too.
Dr. Douglas Wan is the director and founder of Minimally Invasive SpineCARE, located in Plano, Texas. He's a fellowship-trained spine surgeon, board certified by the American Board of Orthopedic Surgeons. Dr. Wan is also the director of the Regevity Stem Cell Institute. He's chosen as one of America's top orthopedist spine surgeons by Research Consumers Council of America, and he provides the most comprehensive methods of minimally invasive and endoscopic laser spine surgeries available to treat cervical, thoracic, and lumbar disorders. He dedicates his spine practice to only minimally invasive techniques. Dr. Wan has pioneered some of the most innovative surgical techniques utilizing the healthcare industry's smallest incisions to avoid traditional open back surgeries of the neck and spine. Dr. Wan has also been practicing regenerative medicine and stem cell therapy for over 11 years. Plant-based nutrition is a key foundation of regenerative medicine and is part of his 4 pillars of successful stem cell therapy.
The cool thing about Instagram is that it really highlights the quote, "A picture is worth 1,000 words." We have a great time on Instagram and Instagram stories, bringing plant-based living to life for all of you. There's only so much that you can hear in the episodes that we cover, but we also wanted to help inspire you and give you more tools for everyday living. So whether you're looking at how we're posting our meals, our workouts, our general healthy lifestyle tips, food shops, blogs, or time-saving tips, or the occasional goofy thing that our plant-powered kids did, we put it up there for you. So be sure to follow Plant Trainers on Instagram and say hi and interact with us. We love getting to know you there.
And now for a moment of gratitude.
The other day we were decluttering and I sold something online, and the lady that came over to purchase it was so caring and so loving and had this amazing heart. She used to be a nurse, has this heart for helping people, and it was just a beautiful conversation that I had with a complete stranger. So I'm grateful for the opportunity of meeting unexpected friends.
All right, everybody, I apologize in advance for this plant-based cheese, but the other day was our 16th wedding anniversary, and I'm just so grateful to be able to continue to spend my life with you, Shush, and I just wanted to share that with everybody.
Dr. Douglas Wan, thank you so much for joining us on the Plant Trainers Podcast today.
Oh, thank you for allowing me to be present today. It's a great honor.
We can't wait to get into talking to you about the research that you've done and all of the procedures that you do and basic overall healthy living for everybody. But before we do, we want to remind our listeners that if they haven't already, that they should definitely subscribe to the podcast, either right now or when it's done, and definitely share it out with as many people as possible, because the more they subscribe and the more that they share, the more we're able to reach other people and to help other people and get messages out to other people and let them know about the amazing guests we have on, just like Dr. Juan, because it could not only help somebody's life right now in a small way, it could really help somebody's life in a big way later on. So we're really excited for our listeners to share this podcast out and to subscribe. Dr. Juan, do you have a moment of gratitude that you'd like to share with us? Because we're so grateful that you're here today with us.
Yes, absolutely. I'm very grateful for my wife, who loves me dearly and who provides me all the great support so I can do all the things that I need to do outside the household, especially when I have a busy practice, but also on top of that, trying to spread the knowledge of the plant-based nutrition. And of course, my parents, who's always given me the unconditional love and support.
Beautiful. I wanted to know, I heard you talking on a show the other day and you were saying everything that you eat in a day. I wanted to know, do you prepare that, or does your family help you prepare that food also?
Most of the time, 90% I prepare myself. I'm pretty particular about what goes into my meal, as I see food as medicine first. Of course, I love the taste of it, but also just even tonight, my wife prepared one of the plant-based pasta dish. So she does help me with some of the preparation also.
And is she plant-based as well?
Yes.
So how did you guys find plant-based? How did you become plant-based?
I thought I was going to get in trouble there, by the way, because you said that you prepare 80 or 90% of your meals, and Shash over here is preparing about 80 or 90% of my meals. So I thought I was going to get a little trouble there.
Well, I'm supporting you in everything that you do
know,
to be able to
appreciate
do the
that.
podcast and coach clients and teach and coach and all those
I didn't mean to
things.
interrupt, but yeah.
Yeah. Well, we do have a little bit of different tastes and things that we enjoy. So, I'm particular and she's also particular. So it's a fine balance. And then, we do have a little bit of a different schedule. So it works out. So she prepares 90% of her meals and then, eats 10% of mine. So essentially it equals out. But I became a plant-based because, actually, ever since I was a little kid, I just really had a difficult time, consuming meat products. Coming from a Korean family, the fish, they typically serve whole fish or whole chicken. I just, connected with the animals early on. But then, just like most families not having the knowledge of the nutrition, everyone typically ate the meat. And that's how we grew up. But as I started really developing minimally invasive surgery, I've been practicing for 14 years. It benefits the patients, but I'm using 2 X-ray machines during the surgery every single day. And I get quite a bit of exposure to radiation. And I've noticed some of my older colleagues passing away due to thyroid cancers, developing cancers in their hand, because they work so much under the radiation. And over the past 10 years, being one of the busiest spine surgeons in the area, I probably got double, triple dose of radiation compared to the other spine surgeons in the area. So, I got to thinking, and this was deeply concerning. So a few years back, I started really doing research on how to prevent cancer and how to prevent chronic disease. And plant-based diet started coming out. And I started, I was perturbed and then a little bit angry that I never really learned and never had an exposure to the plant-based nutrition, how we can use food as medicine. And once I started digging and digging and digging, discovering all the truth, it was pretty shocking. And I realized that part of my medical school training was a waste because we learned how to write prescriptions, learn how to learn about the disease process, but not really learning how to truly treat the cause, not just managing the effect. And that's how I really jumped into the plant-based nutrition.
Sorry, I'm going to cut you off for a minute. When you say that part of your education was a waste, do you actually feel as if you were learning things that weren't necessary at all, or it was a waste because they wasted the opportunity to teach you about plant-based nutrition?
Yeah, wasting the opportunity mostly. I think everything we learn is important. It's important to understand the pathophysiology and anatomy, and then certain medications to treat certain disease. But so much of the emphasis in medical school is about what drugs will be utilized and how it can affect the disease process. Not so much on how to prevent it and how to treat the actual cause. And I use diabetes as a perfect example. I've always thought you got to, lower the sugar, stop eating carbs, and then give them metformin or insulin to manage their diabetes, which most family practitioners, internists, and a lot of the other physicians do. And it's been shocking as a spine surgeon through our free monthly seminars that a patient who's been suffering from diabetes for over 13 years, insulin-dependent type 2 diabetics, within 10 days are able to come off the insulin. And within a few weeks, they can significantly decrease their oral medications such as metformin and glipizide. And within 2 to 3 months, they're essentially cured from type 2 diabetes. I wish I would have known these things during medical school or even during residency, but it took me many years of just practicing blindly to a certain degree. But also, of course, as a surgeon, those weren't my primary disease to treat. But I wish I would have been had the knowledge to properly counsel the patients over the past 14 years.
So, what is your actual day-to-day job? What are you doing with your patients?
Yeah, so my primary practice is spine surgery, but I do provide a comprehensive care in our clinic. So patients with back pain, neck pain, or nerve compression, they come in and they typically get after evaluation, we'll get conservative treatments such as physical therapy, may occasionally get some pain injections. Only if they fail all the conservative treatment, then they would see me and I would counsel them about surgical options and then provide either minimally invasive spine surgery or laser endoscopic surgery. But my clinic also reflects the rest of the America. 80% of my patients, or sometimes even more, are either overweight, obese, or severely obese. And in the past, it was pretty sensitive to talk to patients about their weight management. I even had patients going back to their PCPs, their internists or family practitioners, and saying that Dr. Wan said, reason I have back pain is because I'm fat. Well, I wouldn't address it that way. I would specifically talk about their disease process and also how they can potentially manage their weight and their diet so that they can possibly avoid a surgical treatment. But once I really realized how they can treat overweight, obesity, and other chronic disease through plant-based diet, I am much more aggressive about counseling them about their nutrition. I probably spend 60% of my time when I spend time with patients talking about nutrition rather than spine surgery.
And how do your patients react to that?
And I think more and more patients are, accepting it. The buzz is out there. Some great documentaries been out there. They've been hearing about plant-based nutrition or healthy vegan diet. So they're a little bit more open. But also at the same time, I practice in Dallas, Texas, the state of barbecue and steak, and people are very emotionally tied to their meat. And some patients actually get quite angry. And one patient actually, I remember, just got up and walked out and said I was a lunatic. But those are very few percentage of patients. And I think more of them are willing to listen. And because I also counsel them how it can improve their surgical outcome and help them recover from surgery and minimize the complications, because it's going to boost their immune system and it's going to decrease their potential incidence of infection. So many of them are actually willing to listen, at least give me a chance to listen.
So do you find that your patients who are following the diet protocol or the lifestyle protocol are recovering faster from your surgeries and not needing follow-up attention?
Oh, absolutely. In fact, some patients who I thought they're going to need surgery or who they thought was also going to need spine surgery ended up not having surgery. If they do full transition, as you know, some patient can lose the weight so drastically and their back pain just disappears. So sometimes we joke that I'm, working to get myself out of a job. Because
you're putting yourself out of business.
Yeah, exactly.
But that's almost a good thing. As long as you could recoup somehow, it's a good thing for people.
Yeah, and my father had suffered from spine surgery. That's why I went into the field. And if I can help patients gain their life back, and that's my primary goal, my job is not to do the surgery. My job is to make sure that they feel better, and so they can regain their life. And then patients who do end up having surgery, I specifically counsel them how plant-based nutrition and also increasing their fiber can help them recover much faster. And many of them do. Specifically, if I do surgery, we call it 360, going into the spine, approaching it from the front through their abdomen as well as through their back. And many times after the surgery, if you do any surgery through the abdomen, they get bloated and they may stay in the hospital a lot longer. The patients who adapt to plant-based nutrition and also are able to increase the fiber intake, their bowel moves much faster, so they feel much more comfortable immediately after surgery. They're able to be discharged from the hospital much sooner. As far as the infection rate is concerned, because my practice is primarily minimally invasive spine surgery, so it's extremely rare that I do get any kind of infection, and that's really due to minimally invasive. But the patients, what I've seen is that they regain their energy much faster and able to recover significantly sooner than patients who are still consuming standard American diet. And when we do counsel the patients, we ask them, hey, just give me 6 weeks after surgery. You're having a spine surgery. If you give me 6 weeks, and then after that, if you want to go back to where you were eating before, you can go do it. But 6 weeks is the most critical time. But by the time they get through the 6 weeks, so many of them feel so much better, and they see the significant weight loss also. And then many of their chronic disease process improving significantly. Even they may not do 100% plant-based, but they incorporate a lot of the principles of the plant-based nutrition into their daily life.
What kind of patients are you seeing? Like, what's the reason behind them needing these back surgeries? Is it due to chronic illness? Is it strictly because they're overweight or obese? Is there because of the inflammation that's being put on the spine? Or is there anything that you could kind of pinpoint?
Yeah, I think one of the biggest thing is the overweight or being obese, putting more stress to their spine, creating back pain, and also their spine degenerating faster, or also the discs themselves getting injured due to increase in stress. And there's other thoughts of people eating the food that creates increase in inflammation in their system as well as into their spine. We talk about a lot of problems with the circulatory issues. Why does somebody develop a degeneration of the spine? Spine has a really poor blood circulation, and only very, very small vessels go through the just outer edge of the disc. And if you have early signs of atherosclerosis, the chances are your small vessels are going to be damaged around the spine. And I believe that that's part of the reason why some patients develop early degeneration compared to the others. So I think the issue is pretty complex. But I think the diet and lifestyle also plays a significant role.
Does genetics play into it at all?
Yeah, absolutely. I think the genetics can play definitely a role. But as we understand, as other chronic disease, genetic is there, but then that shouldn't make somebody crippled, because you can change. Just like the more studies are coming out about the epigenetics, you can turn the genes on and off. So based on, even though you were born with certain gene so that you develop the degeneration earlier than later, that through the diet and lifestyle change, you can manage. Because I've seen that with my father. Right? My father, after he's had multiple complications and infections after his open back surgery, and he had a chronic pain for 30 years. and we didn't have any insurance. So his pain medication was alcohol. He would work in the night as a janitor, and during the day he would drink alcohol to put himself to sleep, not because he just wants to be a drunk, and suffer for 30 years. But once I got out of the medical school residency and fellowship training, we really focused on his nutrition. He stopped smoking. He ate better. He lost weight. And how often do you see Asian men overweight? And he had a huge gut. And once he lost that and they start exercising and changing his lifestyle, then his back pain was much more manageable. So in his early to mid 60s, he started playing golf. And the golf puts a tremendous amount of stress to the low back. But that's how much he was able to improve his health overall. And so through the diet and lifestyle change, you can overcome many of the genetic disadvantage.
It changes your whole life. I mean, when I speak internationally about getting kids to eat better, one of the stories that I tell is how one of my clients, Melissa, how her children ended up eating better. But what ended up happening is she wasn't willing to go plant-based 100%. So it was more like 20% vegetarian, 80% completely vegan, plant-based. And within 2 weeks, she hadn't slept a full night in her bed for years because of her chronic back pain. They bought a lazy boy so that she could actually sleep in the lazy boy when she woke up at night. But she started sleeping through the night and sleeping in her bed all night long. That chronic pain went away. And when she went one night to the Waffle House for dinner and changed the protocol for the night, that was the one night that she wasn't able to sleep in her bed anymore. So it makes a huge, huge difference, even day to day, what you're eating, of course.
Oh, absolutely. Absolutely. Because, even based on what you eat, within 24 hours, the type of diversity of your gut bacteria changes within 24 hours that quickly. So that's why you have to be very mindful of what you put in your mouth every single day. Just like, Dr. Michael Greger says, anytime you put something in your mouth, it's an opportunity cost of, not being able to eat something healthier than what you're eating at that moment.
But it's not just what you eat, right? You have 4 pillars of health that you consider.
Oh, yeah, absolutely. Because when I was thinking about how to prevent myself from getting clinically significant cancer, because I believe after a certain age, everyone has cancer cells in their body. And our body is constantly fighting the cancer cells and preventing it from becoming clinically significant. And so the 4 principles that I live by is by peace. P stands for plant-based nutrition. And it's not about just not consuming the meat or animal products, but it's consuming the food that is going to heal our body, properly fueling our body. And then the exercise, which has strongly demonstrated it can fight cancer and many other chronic disease, and avoiding toxins, and then stress management through either meditation, yoga, or any other means, but managing your stress, because depending on how you respond to stress also affects how much cortisol you release, how it affects the diversity of your, microbiome. And then based on what type of a microbiome that you have, it changes your personalities and behaviors. So it affects how you respond to stress. So it's almost a full circle. But those are the 4 main principles that I try to live by and practice every single day. And I try to teach my patients and, my colleagues.
We're taking a short break to let you know that this episode of the Plant Trainers Podcast is brought to you by Four Sigmatic Foods. We were first introduced to Four Sigmatic Foods while I was browsing a natural food store looking for a coffee-like substance that would provide some energy and some health benefits. And as I was looking around, I was drawn to this mushroom coffee mix. It contained cordyceps and chaga mushrooms, and at the time I was already using cordyceps in my daily routine, and just mixing it with the coffee, it seemed like a perfect match. This combination really got me going in the morning. Whether I was getting ready for a short run or a long run, it didn't matter. The best part is that when you use this mix, you don't even need a coffee machine. And so no matter where you train, you just need a mug and some hot water and a packet, and you're good to go. The quality is amazing. The chaga mushrooms help support daily immune functions, and the cordyceps have incredible antioxidant properties. They provide energy, stamina, and help to improve athletic performance. They use 100% organically grown Arabica beans in every packet, and it's all third-party tested. And now, best of all, they have these pods. So if you do have a Keurig, you now can have this mushroom mix coffee in your Keurig, which is pretty awesome. So if you want to get a head start on your training day, go to foursigmatic.com/planttrainers. That's foursigmatic.com/planttrainers. Search for the item that calls to you the most, and be sure to put in the discount code PLANTTRAINERS, all one word lowercase, to get 15% off your order at checkout. And now back to the show. I love that piece. I love that. So we talked a little bit about the nutrition, how important it is that you're putting good quality food into your mouth and how your body reacts to it and your mind reacts to it. We didn't talk about the E at all. So the exercise, are there specific exercises that you recommend people do if they don't even have any spinal issues, or if they do, or is it different? What kind of exercise do you recommend?
Yeah, I think whether you have spine issues or not, back pain is the second most common reason why people go see their physician, just about any countries.
What's the first?
Common cold.
Really?
Yeah, common cold is the most common, and then
people
second
stay
is
home. Keep your germs at home.
Yes,
Don't go to the doctor for that. Save your money.
Exactly. and especially in America, right? Mm-hmm. And so, but the core strengthening and stretching, it's key. Everyone should always learn how to protect their back and maintaining good posture. That's a basic start. But then also low impact cardio exercise program and just getting your blood flowing. And those are critical. But for everyone, just beyond spine, everyone should be doing walking 90 minutes a day or moderate level of exercise for 45 minutes a day, if all possible. There's a lot of different kinds of studies where it says, well, if I work out, do high intensive training for 1 minute, it has the same cardiovascular benefit as doing it for 20 minutes. But we're not just talking about heart. And there's enough studies out there that if you're going to be walking, you got to walk for 90 minutes each day, or if you're going to do at least moderate level of exercises, 40 minutes. And during that 40 minutes, you can do either high intensive training. You got to make sure you work on your core. You also got to, most guys that I know really hate stretching, but stretching is extremely important to decrease the stress to your low back. And I think that's a very important part of the exercise regimen. And I get up every day, 5 o'clock in the morning, and that's the first thing I do is drink my lemon water. And then after that, then work the exercise for about good 45 minutes. You got to put your health first, and I've chose to do that. And for many years, I didn't, and I was so focused on just working and developing the practice, and then realized I was destroying my health. And now in order to survive long and being able to take care of the family, I got to think about my health. So I put myself first. And then first thing I do in the morning is to exercise.
That's a very common pitfall. I mean, most people don't think of putting their health first, and it's amazing that you did. And what can you say to somebody who doesn't put their health first to remind them that that's what they need to be doing?
Yeah, I always tell them to think about their family. As family and their relationship is the most important. I think that really goes towards also the part of the stress management. But you're working hard to support your family. But I see many people where they pass too early, too soon, and it has a detrimental effect on their family. And so I tell them if they're not going to do it for themselves, they have to take care of their body and their health for their family, for their children, for their wife or husband, and rest of their family.
Yeah, a lot of people say, I can't find the time, or I can't afford not to work to be able to work out. But if you can't afford it, what won't you be able to afford later because you won't be around to afford it? So I'm just thinking, if people are like, how am I supposed to get that 90-minute walk in every day? Well, wake up first thing in the morning and go, or bring your family with you, or walk to the store and carry your groceries home. Or instead of watching Game of Thrones sitting on the couch, get moving and run in the spot, or get unlimited data and watch it while you walk, right? Put Netflix on your phone and watch it while you walk. If you really want to, you can definitely make it happen. I remember I was having a conversation with Dr. Esselstyn, and he was saying that one of the exercises that he recommends is getting one of those weighted knapsacks that you wear for proper spine positioning, but also because not everybody can do resistance training. So those weighted backpacks help with resistance training. How do you feel about that? Not that you're going to argue with Dr. Esselstyn, but
yeah, no, I think that's a great idea. I think that would work. Also, I tell a lot of patients when they're at work, and rather than sitting down, just ask them to get them a standing desk. And standing has sitting, they said, is a new age of cigarette smoking, right? It's killing people. So I tell them that, if you can't find the time to exercise, stand and then move your legs. And don't take elevators, walk up and down the stairs. And there's things that you could do during the lunchtime, have a quick lunch, and then walk around the building that you're working in.
So the 90 minutes doesn't need to be consistent.
Yeah, 90 minutes does not need to be consistent. And so as long as, it's within a day, I think it has the same effect. And if they want to do it, if they don't have 90 minutes, then they can surely find 45 minutes and do a little bit more, higher intensive exercise.
Very good. I'd like to move on to the A of your P's, which was avoiding toxins. And I find that interesting because that could mean a whole list of things. And to some people, that means, okay, so I got to live in a bubble now. So how do you teach people to avoid the toxins that are in the environment?
Yeah, so it's not, when I talk about toxins, it's not just the environment. And
Is
first thing goes back
too?
to I guess
pointing it at him, but I'm joking.
Great.
Partly people, but also first toxin you should avoid is goes back to nutrition. Avoiding things that's going to create more damage. Simple thing as alcohol. And people at our seminars, everyone's always asking, can I drink as much wine as possible because we heard it has a health benefit.
Yeah.
But if you drink more than one glass of wine, then even that has shown to increase your risk of cancer. And so for me, myself, I may have a glass of wine maybe once a month, but I stopped drinking a long time ago. Because alcohol is a toxin. It also has a negative effect on your gut microbiome. And then the even simple thing as, bottled water. It's in a plastic bottle and you don't know where it's been. You may not keep it in a hot car, but, where was it in the truck? What type of, warehouse was it, stored in? And then environment, there's a lot of issue. You walk into a building and there's certain toxins that you can't avoid, but we try to eliminate as much plastic as possible. Even at the house, and then the way we drink, where we store our food. So we're trying to be a lot more mindful of that. And there are things that you can't necessarily avoid, but I think everyone should at least think about that. And see how they're being exposed to different toxins every single day.
So let's talk a little bit about stress management now, which was the last component of your acronym. So do you teach them mindfulness, meditation, yoga, all of the above, or is there a different angle that you take to it?
Yeah, so I don't necessarily teach as I'm not such an expert. My younger brother, actually, he practices mindfulness meditation. He actually teaches and he coaches. But I myself, I grew up in a very Buddhist family, and many of our relatives are Buddhist monks. So I grew up doing simple meditation. But I don't think it necessarily, people think meditation is something very complicated. But I think it's setting, a couple times a day, 10 to 20 minutes to yourself, close your eyes. Or, if you're going to fall asleep, just lightly just open your eyes and just concentrate on nothing but just breathing, right? And then just try to find the peace. And even, Elizabeth Blackburn at UT Southwestern, who won Nobel Prize for discovering telomerase, have demonstrated that the meditation, just simple meditation, nothing complicated, can actually activate the telomerase and increase the telomere. That is a true anti-genetic aging, right? And I myself, right after exercise, and this is a time usually because I get up at 5 a.m, done with the exercise by 5:45, I have about 15, 20 minutes to myself. And that's when I just turn everything off, the music off, and just sit there at the gym and then just focus and do simple meditation. And that has helped me cope with all the different stress and challenges that I face at the hospital and clinic. And I'm able to manage my stress better. And also the stress management is also the way you handle the stress. And learning, I was a type A personality, typical, very motivated, student, and would just get really upset if I missed a question, at a test. But what I try to learn to do is that there are so many things that you can't control in life. You just got to let it go. And that's one of the simple principles within the Buddhism. They said, let it go. There's things that you can't control. No matter how much you stress about it, it will not change. So just let it go. And it took me years to really practice that. And I'm still practicing, but it certainly has helped me manage the stress much better.
And letting it go is one of the concepts in EFT for tapping. Other people know it as tapping, and letting it go is one of the things that we do to talk to our subconscious to allow it to not bother us as much and realize that we can only manage what we're in control of and we can't manage what we're not in control of as well.
Yes.
You mentioned telomeres before, and we've talked about telomeres before on the podcast, but for those people who don't remember or haven't been listeners for that long, are you able to just very briefly describe what telomeres are so people have an understanding of what that is?
Yes, absolutely. So telomeres, if you think about our DNA and our chromosome, it's the end cap that keep the DNA and chromosome stable. So if you can imagine a shoelace and there's a plastic cap at either end, and as we age, that plastic cap gets smaller and smaller and smaller. And once it's gone, what happens to that shoelace? It gets frayed. Same thing happens with our DNA and our chromosome. So as we age, the telomere, the end cap of the chromosome gets shorter and shorter and shorter. And as it gets shorter, our chromosome becomes more unstable. So then that's the part of the genetic aging process. So what the telomerase is an enzyme that rebuilds the plastic cap at the edge of the chromosome. So longer it gets, that means that the chromosome is going to become more stable. So then therefore, that is a true genetic anti-aging.
And then our body stays healthier, our brain stays healthier, and we're able to live with our marbles a little bit longer.
Absolutely.
So what about this research in terms of plant-based living and the effect that it has on stem cells? Talk to us a little bit about that.
Yeah, so it was really interesting that, I've been practicing, stem cell therapy mostly for orthopedic patients with arthritis, people who have injured their tendons or their ligaments. As you may have heard, a lot of the professional athletes would travel to outside the country to get the stem cell therapy because they didn't think that a lot of the cell therapy technology was available or allowed, at least in U.S. But we've been practicing the stem cell therapy for spine and spine fusion, as well as the orthopedic issues for 10 years. But as I start getting into plant-based nutrition, then really realizing what activates the stem cells. Just like even, you mentioned Dr. Esselstyn, and you said, Dr. Esselstyn talks about having dark green leafy vegetables 6 times a day to treat heart disease patients. And many people knew that helped their heart disease, but some people may not have known why it does that. And the main purpose is that to elevate the nitric oxide. When the nitric oxide elevates, not only it vasodilates your vessels, allowing the blood to flow easily through your body, but it actually activates the stem cells and mobilizes the stem cell also. Okay, so that's why it's extremely important. And nitric oxide functions as a second messenger. So so it sends a message to the new stem cells to start differentiating to the type of cell that our body needs to repair itself. But nitric oxide also activates the telomerase as well, so that it increases the production of telomere, keeping our DNA much more stable. Also makes our mitochondria function much more efficiently, which is the powerhouse within our cells, so that it generates more ATP, the energy source within the cell. But within the stem cells, even whether it's heart, and then activating the endothelium progenitor cells so that it can repair the inner lining of the artery for heart disease patients. When Dr. Esselstyn is focusing on treating heart disease patients, for us within the orthopedics, it's the same concept. And we harvest the bone marrow from their pelvic bone, and then we filter them, process them, and isolate the specific type of stem cells. And we're reintroducing it into their knee joint, shoulder joint, or shoulder, rotator cuff, other tendons and ligaments. And then now we need to create an environment where that stem cell can thrive. So the nitric oxide and that's produced from the plant-based nutrition is able to help accelerate that process. So the way I describe it to our stem cell patient is that if you plant a tree in a concrete, it's going to die, right? Your body is a soil. So in order for that plant to thrive, you got to pick the right soil. You got to have the right fertilizer in order for it to flourish. So the same thing with the stem cells. Okay, we have to prepare our body so that it's filled with the right micronutrients, and then the substance like the nitric oxide that activates the stem cell will be plentiful, so that our stem cell can be activated, so that it can repair all the damaged tissues, damaged cartilage, damaged tendons and ligaments. Because we're asking our body to do a lot. It's to turn back the time and those damaged cartilage and ligaments and tendons to repair itself. So we need to really focus on developing the right environment so that those stem cells can thrive. And many stem cell centers really focus on the technology of harvesting the cells and injecting it. But most of them, because they don't understand the nutrition, that's the part that's missing, taking those patients to the next level.
I think, the doctors don't understand the nutrition to take the patients to the next level. But I think that it's so important for people to be sharing this podcast with other people, because you've made it so evident that, it's something that we know, especially a lot of our listeners know, because they've been plant-based for so long or been reading the research for so long. But what you eat doesn't just affect, it's not just about being fat or being skinny or having energy or not having energy. It's really affecting every single thing down from your toes to your gut to your brain. This is what's going to push off dementia for that much longer. It's what's going to allow you to think clearer. It's what's going to allow you to smile more. It's what's going to allow you to live a much more vibrant life, from even down into your stem cells, right? It's not just about the fat that you're eating and avoiding grains and, not eating a donut because it's full of sugar. There's so much more depth to food.
Absolutely. And one thing I like the listeners to understand is this: it's not just the stem cell therapy, transplanting the stem cell, the plant-based is important. We have stem cells all over our body. Every day our body is getting damaged through oxidative stress or different types of injuries. And we have to repair our body every single day, and you need the stem cells to be activated. That's why having the proper nutrition along with the right micronutrients and to activate our internal stem cells so that they can repair itself. That's why plant-based nutrition is the best nutrition to repair the body. That's why everyone who lives this lifestyle quickly understands that they feel better, they have more energy, because their mitochondria are functioning more efficiently. And then many people immediately said their cognitive function has increased significantly in a very short period of time. So that's why it's, you are able to live longer, but it's not about just living longer, but it's also about living younger. And the nutrition and then the lifestyle that we talked about will definitely help them achieve that goal.
And so which plant-based foods would you recommend or do you enjoy every single day?
Yeah, one thing that I focus on is the fiber. The civilization that ate the most amount of fiber had least amount of chronic disease. Our Paleolithic ancestors, I know our paleo diet friends think differently, but our Paleolithic ancestors probably ate around 100 to 150 grams of fiber each day. We know that some of the cultures within the Tanzania still eats that much every day, and there's no heart disease, diabetes, or cancer. Americans are averaging about 10 to 15 grams of fiber per day, significantly less, part of the reason for chronic disease. But so I eat a lot of beans every day, a lot of whole grains every day. But of course, to get all the necessary micronutrients, I eat a lot of dark green leafy vegetables, but I love fruits. I eat like about, I recommend to patients eating about 4 servings of fruit. I probably eat about 10, servings of fruit every day, from blueberries to apple to, mango, just, quite a diversity of different kinds of colorful fruit. And that's my dessert. So that is my favorite food.
It's breakfast, lunch, and dinner for me sometimes. Forget dessert.
Yeah.
It's just so good.
Yeah.
So if people wanted to start taking better care of themselves, making sure that they're keeping their spines from surgery, that they're keeping their stem cells where they should be and activated and strong, what actionable tips do you have for them to start doing right now?
Yeah. So I said, start simple. And if you have disease that you need to treat, then you need to dive in, 100% as much as possible. But for rest, I said, sometimes it is not possible for somebody to jump in 100%. So I said, start with salad, and I teach people how to make salad properly. Right dark green leafy vegetables, and also adding healthy fat like walnuts, pumpkins, and avocados. And then using the proper type of dressing such as lemon juice, balsamic vinegar. And then helping them think about fiber and adding that salad to each meal, and then reducing the meat from the main dish to a side dish, or even thinking about start one day a week. You don't have to have meat every single meal or every single day. And I try to get them to start, and then once they adjust to that, then I ask them, hey, why don't we do a 21-day challenge and jump right in? And then for some others, I myself, this is something that I practice every day. I call it, super anti-cancer smoothie. And I pass out my ingredients to anyone who's willing to, listen or, wants the ingredients. And I use that for breakfast about 90% of the time. And I make about 60 ounces of smoothie every morning. And I drink that throughout the day, entire day. Of course, I have the separate lunch and dinner, but that's one of the things that I recommend because people can't consume as much salad, and I think it's really important. But if they can't, I try to find ways for them to consume all the vegetables and dark green leafy vegetables and fruits, and smoothie is an easy way for them to do so. And so I teach them to consume about 50 to 60 ounces of smoothie every day.
Would you share that recipe with us for our listeners?
Oh, yeah.
Do you want to share it now, or can I get it from you another time and post it in the show notes at planttrainers.com?
Oh, yeah, absolutely. I think, it's quite long, it has about 18 different ingredients. And I'll definitely share the list with you, and you can post them at your sites.
We'll do
Perfect.
that.
Sounds great.
Amazing. This is amazing stuff. Dr. Juan, you're doing incredible work and helping so many people. And we always love spending time with plant-based doctors and learning from them. It's just a great opportunity for us to get more educated and to share that beautiful education with our listeners. So thank you so much for being here with us on the Plant Trainers podcast. If people want to reach out to you, where would you like them to go?
Yes. Again, thanks for the opportunity to be here, because I really believe health is a choice and everyone has a full control of their health. and their destiny. If people want to be in touch with me, I'm very active on social media. You can find me on my Facebook page. It's the Spine Dr. Juan, so facebook.com/Spine Dr. Juan. That's where they can also find our monthly free seminar. We stream it live, and everything is completely free. And then also, we have a closed group if people want to ask specific type of, medical questions or share recipes. It's a Regevity, a plant-based nutrition, and Facebook. So they can certainly find that as well. Those are the two main locations. And then at Spine Dr. Juan and Instagram. And if you ask questions and direct message me or leave a comment, I always respond personally.
That's great. And we love that you do that. So I guess if anybody knows somebody who's looking towards spine surgery and that's where they're headed, that they should check us out to help them get on a plant-based journey to avoid that spine surgery. But if somebody still needs it, you would be the doctor that I would want to go to with everything that you've dazzled us with us today, plus your extensive knowledge of a plant-based lifestyle. And, I definitely recommend people to go to you. That'd be great.
Well, thank you very much. Yeah, it's definitely been a great pleasure being on your podcast.
And of course, we're going to put everything you mentioned in our show notes at planttrainers.com so if people can find you there.
Thank you so much. We're so grateful you spent time with us today.
Thank you.
Thank you so much for listening to this edition of the Plant Trainers Podcast. Don't forget to subscribe on iTunes, Stitcher, Google Play, or any other podcast listening platforms. We appreciate the feedback we receive from you. Every time we get a 5-star rating or review on iTunes from one of our fans, it ensures other people will find us too. Thanks to our patrons. To become a patron, visit www.patreon.com/planttrainers. Even supporting us with $1 really makes a difference. Connect and follow us on Instagram and Twitter at Plant Trainers. Like Plant Trainers on Facebook, join our newsletter, and check out our website at www.planttrainers.com for awesome plant-based recipes and a list of our services. Email your questions to info@planttrainers.com so we can answer them on our upcoming Facebook Lives. We hope we've inspired you today. Join us again next time and have a healthy day.